Well, you know, the sniffles, the sneezes, the coughs, the ick, the fevers, they've been going around, and now doctors are concerned tonight that a shortage of the antibiotic Amoxicillin, which is commonly used to treat ear infections, strep throat, and pneumonia in kids.
Yeah, this is a pillar of fighting infection, and the fact that there's a shortage is stunning to a lot of folks, and now a bipartisan group of lawmakers are urging the Biden administration to act. And they're asking for Congress to help shore up the nation's medical supply chain. Lena Lai has been looking into this story today. Lena, good afternoon to you. Do we even know how this happens?
Well, you know, the FDA says it's because of demand, this surge of illnesses, including RSV, influenza, and pneumonia is creating this shortage because of this increased demand. And many communities, including here in Northeast Ohio, are seeing this huge spike in illnesses. So now antibiotics, of course, are not used to treat viruses. Rather, the demand comes from the bacterial infections, those secondary infections that can happen when a kid gets sick. So parents, you know, you said it was a staple. It's that liquid antibiotic, the pink stuff, as many parents call it. Yeah. You know, for doctors, amoxicillin is the go-to because it kills a certain kind of bacteria, less likely to kill the good bacteria in kids, like some other antibiotics can do. And it's the liquid form that is easier to give to kids that is what's in short supply. It means doctors at Rainbow Babies and Children's Hospital and families are having to do extra work to find it. Ultimately, is this shortage impacting the quality of care?
I would say truly on a minimal level. We do still have the ability and have gone to efforts and have been very successful with those efforts at being able to make sure that we have adequate, safe care for patients.
So tonight, Senator Sherrod Brown announced that he and a bipartisan group of lawmakers are urging the FDA and the Department of Health and Human Services to start a drug shortage task force to address the shortage. They're also looking to pass the bipartisan PREPARE Act, which is intended to bulk up the U.S. supply chain for medicine. We learned a lot about it during the pandemic, right? We'll dive more into that coming up at 5.
And it's interesting because this is not a, you know, highly specialized drug, or this is one that is widely used.
Stuff, right?
You're sick, amoxicillin.
Every parent knows it for sure.
And you bring up a good point. You know, doctors want to make sure, especially right now, make sure that you're not, you know, that families aren't asking for antibiotics when their illness is not indicating for antibiotics, because you can build that antibiotic resistance too, in addition to taking away from the short supply.
So parents just call around if the pharmacy that you usually use is out. Do you just call another pharmacy and just try and track it down?
And doctors will help do that lead work. And there are also other options like the chewables tablet form that can be crushed up and put into applesauce or pudding that kids might have an easier time taking as well.
Okay, good. So it's not like it's gone for a long time.
It's just harder work.
Okay.
Thanks,
Got
Lena.
it. Thank you.